Welcome to the RX class. I'm your host, Dr. Guang Chen. Thank you for your support so far. Today, I'd like to give an interesting perspective because recently this week, my patient asked me the same question and I thought I'd share it with everyone. The patient asked, "Look, Dr. Chen, I have colonoscopies with you regularly, but I never know what actually happens during the procedure. And so today, I'm going to give you a doctor's point of view. Let's start with describing the room. Most operating theaters or endoscopy suites are set up in a specific way. If we go from the out inwards, the room is usually fairly large. It's got vinyl floors for easy cleaning. It's usually got surgical lights at the top. Lots and lots of connectors to connect appliances, gases. Then we've got on one corner of the room the anesthetic machine. We'll talk more about this later on with an anesthetist. But the anesthetic machine is designed to monitor the patient and deliver oxygen. And then we've got the actual endoscopy equipment setup. And so it consists generally of two or three main components. First, we've got one or more screens for which we can see what's happening internally. Then we've got the main, I guess you could call it the server or the mainframe. This delivers the light source to the scope. It processes the images. It allows us to insufflate or deliver carbon dioxide gas. This is important to help us visualize the intestines better. It has suction to allow us to remove any liquid or effluent material. And from this mainframe, we have the connection to the scope. The scope is divided into essentially three main parts. The umbilical cord, which is the line connecting the mainframe to the handle. And then from the handle, we connect to the insertion tube. The insertion tube is the part that goes inside the body. For colonoscopy, the insertion tube is typically 1.3 to 1.6 meters for an adult, and it's about the thickness of an index finger. The insertion tube has a lot of components. It has several light sources, a camera source. It's got channels to allow us to suction effluent liquid. It's got channels to allow us to insufflate with gas, as well as there's a main working channel which allows us to insert instruments down to perform small procedures, which we'll come back to later. Along the insertion tube, there are also mechanical wires placed along that allows manipulation of the tip, allows us to bend up, down, left, and right with the handle. And then if we move to the handle itself has the manipulating dials, as well as several buttons to change the color settings, allows zoom, focus, taking pictures. It also has buttons to allow us to insufflate gas, suction, as well as clean the tip of the scope. Now we come to the patient. The patient is usually set up in the middle of the room with an adjustable bed. The patient is typically dressed in a dressing gown. They may or may not have already had a small plastic cannula put into their hand or arm to allow the anesthetist to deliver the anesthetic agents. They typically lie down. We check details, including their name, procedure, allergies, as well as any other details that are relevant in that particular day's surgery or operating theater. The patient would lie in a left lateral position with the knees tucked up towards the tummy. Now let's go through the actual colonoscopy. The patient is currently lying in the left lateral position. I would typically have a look around the bottom to identify any external features such as hemorrhoids, skin tags. We would apply a small amount of water lubricant before inserting the insertion tube. So how I would hold the scopes, I would have the handle in my left hand and I would have the insertion tube in my right and would gently navigate through into the colon. Now what's interesting is on the screen, everything is in reverse. So what I see is on the top is actually at the bottom. What I see on the left is on the right. And with the current scopes, we're getting 4K resolution. As I'm progressing through, I turn and twist, and I can alternate the tip position to allow me to navigate through the intestine. Unfortunately, unlike a plastic conduit tube, it's not a straight line. It goes up, down, left, and right, and there are sometimes very tight bends. And we use maneuvers to get around them. Occasionally, we're getting some effluent material, such as liquid stools. We can suction this or wash, and we typically navigate throughout the whole colon. We're going through different parts, and on our way out, this is when we'd really take a very detailed look at the colon. If we do see anything unusual, we are able to take samples with biopsy forceps. The biopsy forceps are designed to go through the scope. So they're typically longer than the insertion tube. On average, they're about 2 to 2.5 meters long. At the tip, there's a little. There are two cups which essentially close and cut. And at the end, we have a small handle which allows the nurse to control the tip. Similarly, if there are unusual growths such as polyps, which are little mushroom lesions or flat lesions, these can be removed using snares. So snares have a similar principle. They're a very long plastic tube, and at the end there's a handle. At the tip, there is a small loop of wire. And when this loop is closed on itself, it acts as a cutting knife. And lastly, as we come all the way out, we have a very good look. And at the end, we remove the scope. The patient is cleaned up and returned to recovery. I forgot to mention that along with all of this, there are many people in the room as well, including the anaesthetist, which is the doctor putting the patient to sleep. Often we have 3 nurses, one nurse assisting with the airways with the anaesthetist, one nurse assisting me, and the other nurse to get any necessary supplies and to do paperwork throughout the procedure. I hope this was a helpful audio description of the colonoscopy. Please reach out to us if you like more of the same or any other topics you like discussed. As always, if you've enjoyed the podcast, please subscribe and give us a 5-star review, and I'll see you next time.